So October 27, 2020, we now have 4,538 cases. Something like 2,800 of those have happened since the 1st of September. We have 65 deaths. 25 of those have been since the 1st of September. We have 3 Ingham County residents in the hospital, 1 in ICU, and outpatient, basically 971 cases right now for a calculated case fatality rate of 1.4%. We have 3,499 people recovered. So if we look at our hospitalizations, it looks like this. So we're trending back down in hospitalizations again. I will tell you though, I do have numbers from Sparrow, McLaren. I have numbers from our local hospitals, and I can tell you that our hospitals do have quite a number of patients in them. I think approaching 70, in fact, COVID-related illnesses in the Ingham County health systems right now. So a lot of our patients are from outside the county, clearly. So this basically shows you, and I'll get that number for you before the end of the briefing, because I think I have it on the system I'm logged into right now. 77.1% recovered, 21.5% active. So those are people who are at home or in the hospital, and 1.4% deceased. So our cumulative case curve now looks like this. We did have this significant increase back in September. But really, even though we're leveling off from that, we're definitely not flattening out per se. So our daily incidence curve now looks like this. So this is the outbreak that we saw end of June, middle of June, early July. There were a couple of different ones in here. This is basically largely driven by MSU related cases here in September. And then after that, just basically a lot of community transmission. Our percent positivity has gone closer to 5% over the last month, 2 months since early September. When our cases started trending up, we had been hovering down in the 2-3% range. So you can see here we exceeded 5%, and we just kind of sit here and hover very close to that 5% range. So this is those daily incidence curves and percent positives put into a 7-day rolling average. And so you can see here what I've been saying about our percent positivity that has gone up from this baseline we were hovering in down here to a baseline that's more kind of up in this level here. If we look at the cases, we have 1,751 to 1,760 of our cases in our 48823 zip code, followed by 48911 at 591 to 600. And then again, basically, you know, half again the number of cases, 48910 at 341 to 350, and then on down from there. If we look at that in a case rate map per 100,000 population, we see that our East Lansing zip code is our highest shaded population. And then we have basically 48911, followed by 48910, and those are basically our highest prevalent zip codes. We do have some cases out in the Meridian Okemos area as well. And then this is out towards the airport. So kind of a countywide heat map looks like this. We zoom in a little bit, Lansing and East Lansing. Again, this is the 48911 zip code we were talking about earlier. And here's where we are still with 48823. And then just in the city of East Lansing, zooming into that, it allows us to kind of spread out that one giant heat map blob into a little bit of separation here. So we see these cases in East Lansing. These are some apartment complexes here, here, and here. Also in here, another one in here. These are some apartment complexes in here. This is that Water's Edge area down in here. 50% of our cases are female, 50% male, and 40% still in that 20 to 29 age group, with another 19% in the 10 to 19 age group. So that 18 to 24 demographic is really still driving a lot of our cases, although we're seeing cases just start to basically be in all kinds of places across the community, as well as all kinds of different age ranges. It's just going to take, it would take a lot of cases to catch up with that 20 to 29 age group at this point in time. because of the significant number of them that we saw in September and October. We are basically looking at 66% of our cases are Caucasian, 14% African American or Black, 6% Asian, 11% other, and 3% unknown. We have a prevalence of 1,397 for Caucasians, a little higher than that in our African American population at 1,887, and then also higher in our Asian population, still at 1,471. When we look by ethnicity, we have 82.4% of our cases not Hispanic or Latino, and 8.6% Hispanic or Latino, 9% unknown. And then that map rate, basically not Hispanic or Latino, 1,386. And unfortunately, this number is, whoops, not here. So I have to apologize for that. Didn't get a chance to look at this because I was probably doing what you all were doing, which was watching the president's rally in advance of this news briefing. So our cases, our deaths now at 65 by age, 1.5%, 40 to 49. We have not seen a death under that age group in this county. 6.2%, 50 to 59. 12.3%, 60 to 69, 35.4%, 70 to 79, and 44.6% over 80 years old. So you can see that really predominantly, if you look at our over 70-year-old age group, so 70 plus, that is the significant proportion of our deaths are in that age demographic. By sex, our deaths are 52.3% male, 47.7% female, and then 69.2% Caucasian, 23.1% African American, 1.5% Asian, 3.1% other, and 3.1% unknown. By ethnicity, 89.2% not Hispanic or Latino, 4.6% Hispanic or Latino, and 6.2% unknown. At this point in time, I'm going to show you all of the MSU related graphs, but as we move forward, you know, just as we did with any of the other outbreaks that we were tracking, we will probably go to just that weekly graph as this outbreak has kind of leveled out. And now we're just looking at generalized community spread as we see spread throughout the state, as well as throughout the country, as well as in Europe. So this was the outbreak we saw late August through early October, mostly MSU related cases. So these are our MSU related cases only. We had days where we were looking at over 100 cases per day. So positivity also was very high in our MSU related cases and has now tapered off to be pretty much equivalent to our county related county positivity rates. But the other thing you see here is a lot of jumping around. I mean, this is a 7-day rolling average. The intent of a 7-day rolling average is to smooth out a curve. So when you take a 7-day rolling average and have this kind of bouncing around, there's a lot of variability in testing that's going on here, which creates a lot of variability in percent positivity. This is just the graph with daily incidents, also with a 7-day rolling average, with that 7-day rolling average for percent positivity. And again, you just can see a lot of this is a lot of bouncing around for a 7-day rolling average, I would just say. When we look at cases by week, we still are looking at that week of September 7th at 640 cases, where we peaked out 368 the week before and over 300 the week after. And then we've been hovering down in, you know, a little over, a little under 100 cases per day. Now looking at 53 last week, or the week of October 12th. And then you will see additional numbers fall into the week of October 19th as cases get diagnosed and onset dates get determined. And then basically just looking at our cumulative curve relative to our MSU cumulative curve, just to again show that, you know, this serious tick in cases, this extreme increase within this graph, it really parallels MSU related cases which caused the increase here. That is flattening out, but now as a county, we continue to have an upward rise in cases in terms of cumulative case counts. That is where we are related to that. Let me see if I can find where did you all go? My mouse is not working very well. It gets stuck on my one screen. There we go. It's almost like it doesn't want to, when you use dual screens, it's almost like it doesn't want to come over to the second screen. It gets stuck. So it's a strange thing. Anyway, I wanted to show you all as well the My Start map, because we've looked at that before, and I wanted to show you where we stand with that right now as well. So here's the private side My Start map, which, as you know, has got a little bit more information in it and has some interesting features in it compared to the My Start map that you all have access to. So we are logged into my user account, and for some reason, the system is not showing anything. There we go. Whoops. Okay. There we go. So if we sort by daily cases per million, we can see basically what's going on across the state, where you can see a lot. And if you look at the COVID Act Now map, you will see this trend also. And I've seen some reports about this as well. And that is that we are seeing right now some of our significant increases. And if you look at the COVID Act Now map, it's largely in the Midwest and some in the Northwest and a few states down south. But what you should note about that is it's largely rural states. And as well, we can see some of our highest case rates are now happening in fairly rural counties in Michigan. These are UP counties for the most part. And then, you know, Calhoun County here at 358. So there's regions thrown in here too. So Kalamazoo is a county versus Kalamazoo is a region. So you can see that we have to go all the way down here in terms of counties to somewhere in this range before we get to Ingham County. There you go. Ingham County currently down here at 106. Notably, we are in a decrease in terms of cases per day per million, as well as positivity. So we've been a week decreasing, a week decreasing here as well. The trend you will see mostly across the state is a lot of, here's 6 weeks statewide of increasing case numbers, four weeks of increasing case numbers, 5 weeks of increasing positivity. So if you look through this, you will see a lot of that going on. So right now, as a county and as a region, we are once again in a position where, though these are higher rates and higher percent positivities than we saw before, we are doing well relative to many portions of the state. Here's our region here. And then we can select our county here. So you can see that 1 week trend downward, 1 week trend downward. I would argue we're getting closer to two weeks at this point in time. And then you can see these graphs, which show this positivity got up close to 6%, 5.9% on September 14th, and then got back down into about the 3% range. And so we're just kind of hovering in here in the 3 to 4% range. Daily cases per million over time. You know, this looks very much like the graph that I just showed you that we create ourselves. But you can see that we are in this downward trend really since, early October. So that is where we have been as a county. And I can confirm that that is true. We have seen quite a number of deaths in this last 7-8 weeks relative to, we had no deaths here for a period of time. And then we had those deaths in August that kind of went down, and we're back to an increase of deaths. So our deaths are starting to look a little bit more like they did back in April and May, which isn't surprising given that we had 29 deaths between the beginning of the pandemic in March and about June 8th, we hit that 29 number, and then we didn't have additional deaths for quite a while. And then we've had 25 deaths now since the 1st of September. So I did want to show you that. Okay, questions?
Ben Henry, go ahead.
I'm muted. Yes, I am. Okay. Hi, Linda.
Hi.
I'm just curious as to your thoughts on what you saw today at the Trump rally in regards to crowds and masks and social distancing.
Well, you know, it's very unfortunate. You know, it's been a very unfortunate, you know, collusion of events in that we're in an election cycle. It happens to be a presidential election. We've politicized viruses. We've politicized mask wearing. Our president has clearly not been pleased with our governor, and the president also is rather reckless with regard to COVID and COVID precautions that are recommended broadly across the public health community as well as amongst the scientific community. So we know that basically getting into crowds like that, these people have been here since last night, many of them, from what I've read. So you all would know that better than I have because you've been covering the story. But, you know, we have people that have been here since last night. We've had crowds waiting. The president was late. So the crowds basically stayed out there for quite a while. We saw, you know, fairly mixed mask wearing with clearly a crowd of people that generally does not support mask wearing. And it is concerning. It's obviously deeply concerning that we have those kinds of crowds at a time when we have higher levels of transmission in the state and in the county. Like I said, even though we're doing fairly well as a county, we are still looking at a higher level of transmission than we were looking at in June when we were feeling a little bit safer in terms of where we were, and also a little bit easier to pinpoint where outbreaks were coming from. So it's kind of a, I don't even, sometimes I just don't even feel like I have words for it. It's very disappointing.
Just to
it's
follow
very
up,
frustrating.
I'm so sorry. Just to follow up, are you then concerned that this could be a super spreader event?
You know, I don't have a crystal ball on that. I mean, we've been concerned about protests being super spreader events. We've been concerned about, you know, rallies and things like that being super spread events. Sometimes they've happened, sometimes they haven't. I do know that, you know, there was some tracking of increased cases following rallies of the president. So there have been notably increase in cases in many of the places where there have been rallies. Most of the ones where that was a notable event after the rally, the state itself was in a crisis mode. So I think Wisconsin, wherever he was in Wisconsin recently, saw a 20% increase in cases 2 weeks after that rally. So there have been others that did not increase cases in the area within those 2 weeks afterwards. I would say that, you know, just a quick look at that yesterday, which I did look at, most of those were places where, you know, we weren't looking at high levels of transmission in a state. If you look at the COVID Act Now map right now, you can see that many of the places he's been and are going are red states with very active or imminent outbreaks related to what's going on in that state. And it is the time to be cautious, not reckless. And that's not what we're seeing.
Go ahead, Scott Pohl.
Hi, Linda. I had a question about what comes next over the next week or two when it comes to tracking cases that might be linked to attending the rally today, either here in Ingham County, maybe working in conjunction with nearby surrounding county health officers. Can you describe the next week or two, what it'll take in your mind to get an accurate feel for that?
As to whether or not there was an increase in cases, basically the best thing you're going to have is a metric where we go out, you know, a week to 2 weeks from now and see whether or not we see a spike in cases. That's about as good as we've got. A lot of times what we find is that, you know, people who are aware that they're doing things that are not advisable and high risk oftentimes don't disclose that that's what they've done when our contact tracers talk to them. So we don't always know all of that information. related to where people have been unless they are disclosing that. So, I mean, obviously, people who are having giant parties that aren't supposed to be having giant parties are sometimes reluctant to admit that they were attending a giant party. And similarly, I wouldn't be surprised if we would find some people that are reluctant to admit that they were attending a giant political rally in the midst of a pandemic, which was, not necessarily the most advisable thing to be doing. So we'd be looking for that uptick in cases. We do already, as a statewide system, network and share information. So we get those, those links that basically say, here's another person that was at a particular place or event. So we've dealt with statewide, events, funerals, weddings, all kinds of different things that basically have incorporated cases that have occurred across the state rather than just in one place. So we do have ways of tracking that. It's going to rely really heavily on whether or not people disclose information to contact tracers or even answer their phone calls. So the metrics are probably going to be the easiest thing, and they are basically it's not direct. It's, it's like you've seen in the other places where it's like, okay, 2 weeks after, what was the % increase in cases, right? So here we are now. We know that an incubation period can be as long as 14 days. It can be as short as 2, average is about 5. So between now and 2 weeks from now, what kind of increase in cases do we see here in Ingham County, in the surrounding counties? Many people at that rally today were from all over the state.
Does anyone have a question?
I have another question if I can hop in.
Go ahead.
Have you discussed Halloween, what your advice is about Halloween? Don't do it. Trick or treat, but with these safety measures. Hand out candy with these safety measures. Do you have advice about Halloween?
Safety measures right now, I mean, we're still, we are trending down in this county. We haven't gotten to the point where it's, we're in such excess that we've gone anything beyond following MDHH's guidance, which came out on Halloween. I think that guidance is very good. I support it. And when I get asked the question about Halloween, I refer to that MDHHS guidance. Clearly not advising parties, advising that, children don't, move around in large groups hanging tight together, but rather stay in their families. You as a person at your door, finding ways to make sure that you either, put a table outside and deliver candy over a table, or, other ways of keeping that distance. Keep in mind that, contact for contracting coronavirus, COVID, usually requires that you be in close proximity to someone for a prolonged period of time. So those short, brief interactions aren't necessarily high risk. They aren't also no risk. So the precautions are important, and taking those precautions, we're outdoors. Hopefully we can incorporate masks into costumes, because, that's frequently a Halloween thing anyway. We've got masks, so hopefully we can incorporate masks into costumes. And parents are going to approach this safely. A number of safe events pop up, like trunk or treating and those sorts of things. So there are a variety of different options, and clearly some very, very good guidance from the state in terms of how to go about trick or treating safely.
Rachel Sweet, go ahead.
I also had the trick-or-treating question, so and you answered that, but would you advise people to give out, to sanitize candy bags before giving them out, or just avoid it altogether? Just adding to that trick-or-treating question.
Sanitize candy bags.
Yes, like either wiping candy wrappers down, anything like that. No.
No. The all of this, honestly, matter of fact, I'll share it with you. There's a Wired story, and Wired isn't the most, scientific journal in the world, but it does cite several studies about the whole surface issue in COVID. And as a microbiology person, I was very reluctant, I should say, to give up my thoughts that fomites or surfaces are an important source of transmission. And as the CDC and others started to talk about, really a little bit of minimizing the importance of surfaces, as well as increasing the importance of droplets and aerosols, I was pretty reluctant to say that surfaces are not a big deal. A lot of these studies were done in fairly controlled environments. So when you're talking about, there was one they talked about in here, and somebody showed it to me from Australia, where they showed that the virus stayed on surfaces for up to 28 days. Well, if you look at that actual study, and it is talked about in here, they controlled temperature, they controlled humidity, they didn't have light, so it was in the dark, because all of those things, temperature, humidity, light, affect whether or not the virus survives on a surface. So when you control all of that in a laboratory and then say things can stay on surfaces for 28 days, then basically you've alarmed people, and it's like, oh my gosh, things stay on surfaces for 28 days. Well, in a very controlled laboratory experiment, perhaps. In the real world, perhaps not so much. So I'd encourage you to read this, because I actually thought it was pretty good, and it was the closest it came to convincing me that maybe I can, kind of go along with the trend, which is to say that, aerosol, respiratory droplets and aerosols are the primary source of infection, and that fomites, also surfaces, also contribute to it. But again, you're talking about high touch surfaces. You're not talking about a candy wrapper and things like that. And you're also talking about, I talked to somebody about this not long ago that had talked to an infectious disease specialist. Literally to have enough of a viral load from a surface, random surfaces other than common touch surfaces, somebody would have had to literally coughed or sneezed on it almost immediately before you touched it. Then you touch it and touch your eyes, nose, and mouth to have enough of a viral load and to actually have virus that hasn't fallen apart and been deactivated before there's even an opportunity for it to infect you. So I just read this the other day and thought it was pretty good.
Awesome. Thank you.
Mm-hmm.
Okay, we're going to go back to Scott and then over to Dave.
Hi, I wanted to ask you if you'd look back at Saturday in East Lansing and your observation about a football Saturday. No fans in the stands, no tailgating, scattered reports of some sizable parties. What was your overall observation of East Lansing on Saturday?
In general, we were pleased, but there were a few kind of notable outliers of parties that got larger and needed to be in control, and needing to get East Lansing out there to get those broken up rapidly. We are concerned about this upcoming weekend in terms of football. There is strong rumor out there that because U of M students are in a shelter-in-place order, that they are planning to come to East Lansing to see the game. So I have heard that rumor now. It's been sent to me twice. So we are now going to have to anticipate the possibility of not only MSU students, but also U of M students being in East Lansing to watch the game, despite the fact that it's a home game in Ann Arbor, because U of M is under a shelter-in-place order for their undergraduate students.
Dave Akerly.
Hi, Linda. Wanted to circle back just a moment to the Halloween thing. I know your job would be easier if we all, at least for a period of months, kind of if we all had bubbles, and then this thing would go away. But aside from the precautions that we've all been told about, you've talked about over and over: wash your hands, soap and water, wear a mask, social distancing, be smart. Do you have concerns too? That I know some parents who've said we're skipping it this year altogether, and kids have been kind of, it's tough for them right now going to class on a screen or whatever. And do you have concerns that some people go too far and exacerbate, maybe the situation in their own homes, where things get really on edge because they're taking precautions, but then they take it to an extreme? Do you have any concern along those lines?
I do sometimes, but not necessarily with Halloween, because I do support the decision to we're just going to pass. It is a gathering kind of event, Certainly parties are, for little kids and trick or treating are not as common. And like I said, if we keep people from, roaming around in large groups and keep them in their households, that can be, not a high risk activity. But I still do know people who basically, it's like, I won't go anywhere. I can't trust that people have washed their hands. If I go to the store, I leave my stuff in the garage for 3 days. And then I disinfect everything and wipe I mean, it's a lot. And, we've been trying to tell people that you're getting a little too fearful and going a little too far, and we can relax on some of those things. So let's do the things that we know are critical, important, and then let's, kind of get adjusted around some of these extreme reactions as well. So yeah, we do see that. And it does become concerning in terms of both the excessive measures that some people are taking that they think they need to take to protect themselves beyond the mask wearing and the distancing and the crowds and the washing your hands, as well as, people that are just avoiding, any contact with other people at all. And certainly there are ways to safely interact. And we've set those out, wear a mask, keep your distance, keep your gathering sizes small so that you can keep the distance. If you're gathering with people outside of your household, you still need to consider wearing a mask or social distancing or both. So there are ways to basically engage, certainly, and mitigate the risk of exposure by doing the multiple things that mitigate that risk. And we've talked about this before about when you put the mask and the distance and the lower numbers of people all together, we've essentially mitigated a lot of risk, and it's very effective. And so if people could do those things, then there is, some safety in going about life with those precautions in mind always. It's not just we're just going to have to learn to, quote, we're going to have to learn to live with it. Well, yeah, we have to live through it. Hopefully most of us, clearly not all of us will even live through it. But we have to do that by incorporating all of these measures into place. We don't get to just live through it and ignore all of this science and all of this stuff that basically tells us how we mitigate the risk and lower the number of cases so that we can indeed continue to keep our healthcare systems from being overwhelmed and keep these deaths down. And that is the way we do it.
Can I ask one quick follow-up?
Mm-hmm.
Linda, I had a doctor on today who said that there is an uptick now, and a sizable one, in substance abuse among seniors. And do you have concerns about the after effect, the residual that we will have after this right now for things that are exacerbated by the pandemic and COVID-19?
Yeah, and I have had since the beginning. I mean, when you look at everything from, stay-at-home orders, when, a lot of us were able to remotely do our work, or some of us were able to get paid while we were not working during shutdowns. And a lot of people continued to do their jobs because they were essential workers. And those weren't just first responders and healthcare workers. Those were the people at the grocery store and Home Depot and Lowe's and restaurants that were doing curbside service and. We had a lot of people out there, and they were largely outside of our first responders and healthcare workers, minimum wage, hourly, low wage earners that basically were out. So the shutdown then has an impact on them. It has an impact on many people who, lost jobs during that time, and as well as just that social connection, and, it's amazing how we're almost normalizing Zooming at this point in time. So, yeah, I mean, we're going to see a lot of impacts. We see, I mean, think about school even. That is not an easy decision to make. As much as it's like, well, face-to-face learning and we're concerned, and so we do virtual learning instead. Virtual learning, for the most part, is not the most ideal way to learn for our children. It could be, there are some cases where we have kids that are just really sensitive to stimulus and stuff like that, to where, what I'm hearing is this format might even be working better for some of them. But for a lot of them,
Sure.
This is a challenge. They're challenging with the technology. They're challenged with processing content without individual teacher support. They're challenged with how to interact with adults and their peers. Challenges. So yeah, we've got a lot to deal with after we get through disease as well.
Thank you.
Brittany Flowers, go ahead, please.
Hi, Linda. I know you mentioned towards the beginning about hospitals. I think you said there were 70 COVID-related patients. Can you hear me okay?
You're breaking up, Brittany.
Okay. Can you hear me?
Yes.
Okay. So I think in the beginning, towards the beginning, you said there were 70 people hospitalized within Ingham County with COVID.
Yeah, I pulled up my tracker. 73. Currently.
73. Okay.
Uh-huh.
So
yeah, and
do you know?
Those are our Ingham County hospitals, so they are not all Ingham County residents. 11 of those are in the ICU. We had 39 COVID-related ER visits just yesterday.
Okay, so do you know how the hospitals are standing in terms of capacity? I know that was a concern that you mentioned last week.
Yeah, it is. I mean, you saw the graph last week. We were back up at numbers like we were seeing in April. We are definitely starting to push the capacity limits of our healthcare systems again, and we have to be very cognizant of that. And that's where basically the measures to take to mitigate the spread of the virus are very important for all of us to take seriously and to follow, so that we can continue to allow our healthcare systems to do their work. So yeah, I mean, 73 is a lot. And that is on top of, all of the other cases of everything else that's in the hospital currently. So those are high. Those are some of the highest numbers we've seen in a very long time.
Okay, and you said 39 people admitted yesterday?
39 ER visits. Yesterday.
ER, yeah. Okay.
So those are not admits or discharges. Those are in addition to the current inpatient, and these are adults, basically total adult COVID cases in our health systems. 73, and those 39 are ER visits in the previous calendar day, so they would have been yesterday.
Okay, thank you.
Does anyone else have a question? Go ahead, Ben.
Again, Linda. I'm just sorry. Let me start that over. I'm tired. I'm just curious as to what you think about MSU's spring 2021 plan, and also a follow up to that. Part of their plan, like other universities, cancels spring break and replaces it with a few mental health sort of type days. So my follow-up to that is, do you believe that these kinds of days are a good idea, just given what we're all going through right now, rather than just
rather than the spring break?
Rather, as in, like, do you
better than spring break? Do I think they're good at all?
I would just say both. Just like health-wise, like mental health.
So obviously right now is not a good time to be traveling anyway. So spring break, and particularly in the spring, we don't know what we're looking at. So without being able to predict what spring will look like, having a week-long spring break, which we know can be quite a big party at a lot of our, places. I mean, spring break is just like this concentrated time off instead of summer, where everything kind of dilutes out, and people go to their relative homes and they may party and go to birthday parties and backyard bonfires or things like that. Whereas spring break is just this concentrated, students to beaches and other places and parties and renting condos, places where multiple people cram in and all that sort of stuff. That's what happened when I was in college for spring break. So I imagine that's probably still what happens for college in spring break, which makes it sound like a really, really bad idea. Pivot, one of those words for the 2020, Pivoting to multiple days off scattered out, to give a break sounds like a pretty good plan to me. I have heard some students that are not happy with that, but again, encouraging them to literally take a week off and go and do their typical spring break kind of thing doesn't seem like the smartest thing in the world to do. So I stand by, the decisions of many universities, including MSU, to basically not have spring break and to take breaks throughout the winter. I mean, that's not an uncommon, when you think about education in general, the United States is still this country that does this. We take the summers off. Well, that dates back to us being an agrarian society. Well, we are many, many decades past being an agrarian society. We've gone through the Industrial Revolution. We've gone through the, technology. We've gone through many things since we've been an agrarian society. And yet we hold on to this summer break, which was largely based on we're an agrarian society and we needed our young people to help us with the farms and the harvest over the summer. That's not the case anymore, and yet we still do that. So you see countries that don't do that, and you've seen some schools basically flip to let's take a week off or 2 weeks off at some point in time during the year rather than having that whole summer off. So, likewise, there can be reasons where it is more appropriate to have, multiple smaller breaks rather than that single, much smaller than the entire summer, but still, a week at a time off. That, again, spring break is, I think, notably a party break.
Also, I'm sorry. The first part to that was I also wanted your reaction to the overall semester plan.
So my reaction to the overall semester plan is that I'm cautiously optimistic. I think that there are a lot of strong safeguards that will be reinforced in the engagement with campus, so that basically they can be monitoring. I think that's going to basically also encourage a whole lot more testing. I think that I believe that the requirement is to participate in what they call the Spartan Spit program, which is a testing kind of screening program that at least allows us to identify people who might need to go for a confirmatory test. So right now, with everything on campus, we haven't had a lot of ways to literally require any kind of testing. And this will basically say, okay, you now have to basically be part of this Spartan Spit program in order for us to do better surveillance of cases within the university. So there are definitely some positives to it. So the other part of it is that you can easily, like we saw in the spring, decide that this isn't working well, it's time to stop. It's a little harder to say, okay, we're not so sure about a winter or spring semester, and then get close to it and go, oh, this looks like it could be okay anyway, let's press the go button on it. So it's a whole lot easier to stop that train than it is to start it. So I have full faith that the university will be monitoring those situations. And if we, run into significant increases in cases, I mean, we've already seen some significant numbers of cases associated with MSU. So, I would expect that we would take some serious precautions if we saw anything like that again.